you should listen to the legal statement also in this channel, and all the individuals I have recorded are government contractors or subcontractors acting in the public fora, and they have no expectation of privacy.
Hello, how are you doing today?
Hi, how you doing?
Good. It's been almost a year since you were in the
Almost a year, right. Well,
Right, so what's been going on since the last time?
okay. What's been going on is, I think, now, I've been recently being treated by primary care with antihypertensive medications. Now, I think what the problem we are trying to get at is, until about 2013, for about 9-10 years, my condition was fairly stable. Actually, it was entirely stable. And I had some problem with numbness, dizziness, and it was probably related to an old head injury and a heart condition that came about, maybe like a small heart condition, which was very stable, not getting worse, that came about. So I really didn't get any kind of treatment for like 10 years. So in 2013, when I went for that MRI, and what I discussed with Dr. McCarthy was what the technician did was he injected into the ulnar artery in the left hand, and he flushed water upstream. So the injuries obviously would go, I guess, to the head and to the heart and to the upper body, but
I'm not sure exactly what you're talking about.
okay. In February, I'm sorry?
He wouldn't have injected into the ulnar artery.
Okay. I mean,
And if you did inject into an artery, the artery flows this way, so you can have. I'm just not sure what.
Right. Because what he did is
Where did he put the needle?
He put the needle here.
Yeah.
But obviously, if he puts it here, if he uses any kind of normal force or pressure, it should go downstream, and kind of you get your hand hurting. But he sent it up, and because he sent it up, there's no pulse up here. So obviously, he sent it upstream. Now,
I really don't follow what you're talking about.
Okay.
Because, first of all, he would not. There would be no way that you would inject into an artery on the dorsum of the hand. Okay, there's veins back here.
Okay, there's veins back here. Okay,
Right,
so the back side of the hand.
And the veins flow up here. Well, there's arteries underneath, but there's no way that you would inadvertently.
Oh no, it wasn't inadvertent. It was intentionally injected.
But it wouldn't be an artery; it would be a vein.
Even if it's intentional, he could not. Because what happened now? What would explain the? Because I'm trying to get to the point now.
Let's.
Okay, so
take a time out here.
Right.
What are you here for today?
Okay. So
Stop the tape for a few minutes. You can hear very clearly. Everything started off normal, as a normal history taking, and as soon as it moved in, now he was agreeing. He didn't have any dispute about when I said I had numbness and dizziness in the head related to a small head injury and a heart condition prior to 2013, and he didn't have any dispute there. But then, Dr. Vicker, when I got to the injection at the MRI, what the MRI guy did basically, immediately he's taking issue with, and you can hear he's obviously lying. He first says there is no arteries in the back of the hand, which is an obvious lie, and he says there are only veins. Then he goes on to, when I seemed puzzled by that, then he goes on to state that, oh yeah, well, there are arteries in the back of the hand, but they are deep inside. And he also says that you could not, when an injection is done, it would not inadvertently go to the artery. And now the key word here is inadvertently, which is meaning accidentally. So, which has always been my point, accidentally the injection would not go to the artery. So he's kind of making my argument for me there. But then when you listen to him next, when I pointed out to him, I tell him, it was not inadvertent, it was intentional, because what he said is, inadvertently it would not go to the artery, meaning, so by that statement, what he's saying. If he's saying inadvertently, it would not go to the artery, but intentionally, it can go to the artery. And that's exactly what I told him. Well, it was intentional, and it was not inadvertent. And then you immediately hear him tell a big lie, saying, then it was the vein, right? So, and so when I say it's intentional, then he seems to say that intentionally you cannot get the artery, when he just said a few seconds before that it is only inadvertently you cannot get the artery, meaning if it's intentional you can get to the artery. And so as soon as I said, well, it was not inadvertent, it was intentional, then he immediately lies and says, okay, well then he injected into the vein. No, he did not. He injected into the artery, and the first sign is right there, and which is as the artery goes, because obviously when you inject into the artery, one thing he said is true. When you inject into the artery, which I agreed with him there, the flow should go downstream. So if you inject on the artery in the back of the hand, you should get problems in your fingers. You should get a lot of pain in your fingers. But my fingers are really fine. I didn't get any problem in my fingers, meaning the flow went the other way. And this is so it's not just an intentional injection to the artery, but he intentionally angled it and flushed it upstream in reverse. And that's why when I had the sonogram, the Doppler sonogram of the upper extremities done a year or last year, it showed that the ulnar artery going past the, right in the middle of the hand and the elbow. Okay, the ulnar artery in the middle of the hand and the elbow has completely blown out. And also when you check for a pulse, there's no pulse there. And so he pushed the item back upstream. So everything Dr. Wicker says there is a lie, which he says that it can, even if you hit the artery, it can only go downstream, which is a lie. We see this is proof that it can go upstream. Now, what is true is if it hits an artery, even if it's intentional, it usually goes downstream. But this guy spent 10 minutes jerry-rigging the catheter so he can flush it upstream. And so he did that. He did that well, and he was also a phlebotomist for like 10 years exclusively. So he's pretty proficient with an injection. So, and then when Dr. Wicker gets caught in these lies, he has no way, because this is the key point. The key point, you have to come back to that injection. That injection is the unconsciousness, the injection is all the injuries that came after that, and that injection is the sexual assault. So now Dr. Wicker wants to conceal all those facts and try to treat my condition as though that never happened. And there's no way you can treat the condition, because we are at the basic history stage, and with any kind of a medical doctor's office visit, what the doctors do is they use a SOAP principle. It's called SOAP, S-O-A-P. So they start with the patient first describing his symptoms, and and having a discussion with the doctor, and that's what I was doing there. That is soap. Then the O is the objective, and that's like, where the doctor does a physical exam and the doctor gets the other medical history, so forth, the other lab test, and looks at it. So that's the second point. But he's just stuck at the history point, and he's not going to agree to my history, which is a factual history proven by overwhelming evidence. So he wants to move. So he doesn't want the S. Okay, it is soap. Now it is soap. It starts with the patient describing his problems too. So you have to include that. So he doesn't want to include any of that. So he doesn't really want to go to the S. And then we really can't reach to, now then the O is the objective, which is the physical exam and so forth. And then the A is the assessment. So you go S-O-A. So you cannot reach to the A, the assessment, unless you have done the S correctly and the O correctly. And if you refuse to do the S because you are lying and you are making up these lies about first there being no arteries in the back of the hand, then saying it can only have, and then saying that if you inject inadvertently it will not strike. And then when I said, okay, it was not I never said it was inadvertent, it was intentional. And then he says, okay, then I guess then at that point he says that even if it's intentional, it's not going to happen. So all his lies, along with my clear medical record, and anyone can check, my pulse is not there in my arm, so we know exactly what happened. So there's no dispute on this fact. And even the other doctor, the primary care, he actually was, he used his employee to try to tell me that it's actually normal for you to be made unconscious during an MRI procedure, and it's normal to have it done this way, injecting through the arteries. So now we see all this consistency problem, but obviously this